And so this was an opportunity for us to think about the work that we do in advocacy and think about the community that we want to hear from and be able to pull folks together from across the state in a largely accessible manner for conversations about their health and wellness and things that are impeding their health and things that are contributing to their health, and setting a vision for Wisconsin. What could it look like for all women, Black women in particular, to be well?
Often by day, we don't really spend a lot of time deeply listening to students. I might hear some comments from students and then make decisions based off of that. Policy leaders might listen to teachers and say, hey, what do you need? But no one is really having long-term, interesting, deep, authentic conversations with kids. Just by the act of having the conversation, we're building a deeper connection between students and teachers and community members. But also, we're able to grow out this network and have this outcome of catalyzing change. So using the different tools of the LBM platform, we can go in and do some analysis. One of the people on our board is a doctor of research who's going to look at it and publish out what we find, and using that to catalyze change in education systems.
And the initial charge of that group pre-pandemic was to host 100 living room conversations, meaning we were going to go into the homes of 100 of our neighbors and host small, intimate conversations, standard way, put up the Post-it notes, take notes, go back, transcribe the notes, and, follow up with folks, what have you. So now we're able to connect with those people and collect their voices and make sure that we have equitable reports that represent all of those voices and not just the people who traditionally show up for different types of events in our communities. I love the ability of the technology to really close the gap between our donors, which are usually wealthy or business professionals or corporations, and people in our community who are facing some poverty-related challenges. Very rarely are those groups able to come together in a space that allows them to genuinely engage and connect with one another. So the Local Voices Network technology allows us to bridge that gap.
So a big impetus for starting America Amplified was to try and improve relationships between journalists and communities. And sometimes that meant starting a new relationship with communities that had been left out of access to reporters. The technology helped us to identify themes. I'm sure everyone has had this experience so quickly, which was really essential for producing a weekly talk show and for producing, quick, nimble media that was providing relevant information to communities. Our journalists learning that facilitation skill was huge for us because it really helped put community engagement in practice and helped our journalists shift from sort of more traditional extractional interview practices towards really connecting with communities. And we have seen that is essential for making any kind of improvement with trust. It has to be this authentic connection. And so that was really huge for us. I'm an oral historian by training and practice. And I agree, Keitra, that every oral historian, every qualitative researcher needs access to this technology. Yeah. So amazing.
While we have a lot of epidemiologists and different kinds of data scientists and experts of many stripes and degrees at the health department, there was one piece of expertise that was missing from our work. And that was the lived experience of New Yorkers, particularly those bearing the greatest burden of health inequities. One of the real challenges that we confront with these data-driven approaches is that data are often woefully inadequate when it comes to describing the intersectional experience of being a person. So a data point can tell us about inequities by race, by age, by neighborhood, and we can develop strategies to address those. But the reality on the ground is that as all of those factors come into contact with one another, our strategies and our responses have to be much more complex.
It's interesting when we play these recordings to physicians. After the first one, they're like, wow, that was a terrible physician that must have did that, right?
Mhm.
And they hear the second one and they're like, where hospital are they? Who would let that happen? And by the third one, they're starting to realize, how many more of these do you have? And we're like, oh, well, you can go online and listen to all, blah, 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 opportunities. And so I think that these voices can push policy. And we constantly hear, we just need to hear more from the people. We just need to hear more, but it's not accessible to hear from the people. Well, we're making it really accessible, and LVN's making it really accessible to hear from the people.